A dramatic breakthrough looms as the Senate inches closer to averting a crippling government shutdown that's already paralyzed operations for 40 grueling days. In the heart of Washington, D.C., where the iconic U.S. Capitol stands sentinel, lawmakers are rallying around a potential funding agreement that could restore normalcy to federal services. But here's where it gets controversial. While this deal promises to end the immediate crisis, it sidesteps a major demand from Democrats that could affect millions of Americans' healthcare costs. Stick around to explore the twists, turns, and heated debates at the core of this political standoff. As of Sunday evening, the Senate appeared ready to approve a bipartisan funding package aimed at halting the federal government shutdown that kicked off on October 1st. Sources close to the negotiations informed CNBC that sufficient Democratic senators have committed to support the measure, surpassing the crucial 60-vote threshold needed to overcome any potential filibuster, a procedural rule that requires a supermajority for certain votes, ensuring that minority parties can block legislation unless there's broad agreement. This agreement would keep government operations running smoothly through the end of January, offering a temporary reprieve from the uncertainty that's left federal employees and essential services in limbo. Yet the pact doesn't tackle what had been the primary hurdle for many Democrats: renewing the enhanced tax credits under the Affordable Care Act, ACA, also known as Obamacare. These credits, set to vanish by year's end, help over 20 million Americans cut down on their health insurance premiums, making coverage more affordable for middle and lower income families. Think of it as a financial lifeline that bridges the gap between what people can afford and the rising costs of medical plans. Instead, the deal sets up a future vote in December on a bill chosen by Democrats to potentially extend these subsidies, a strategic concession that leans on public sentiment favoring their continuation. Senate Majority Leader John Thune, a Republican from South Dakota, expressed optimism about wrapping up this drawn-out impasse. "After 40 long days, I'm hopeful that we can bring the shutdown to an end," he remarked, reflecting the collective fatigue after weeks of gridlock. Thune brokered the agreement in collaboration with the White House and key Democrats, including Senators Jeanne Shaheen and Maggie Hassan from New Hampshire, along with independent Senator Angus King from Maine. And this is the part most people miss: the deep divisions even within the Democratic ranks. Senate Minority Leader Chuck Schumer of New York lashed out vehemently on the Senate floor, declaring he wouldn't back the deal. He accused Republicans and President Donald Trump of stonewalling efforts to preserve the ACA credits, warning that their stance could spike insurance premiums for countless individuals starting in 2026. It's a heated clash that underscores how healthcare policy remains a battleground, with one side prioritizing fiscal discipline and the other emphasizing access to care. Could this be seen as Democrats compromising their principles for short-term stability? Or is it a savvy move to position their priorities for a later showdown? The debate rages on. Insiders revealed that at least 8 Democrats plan to vote yes, pushing the total votes to 61 and clearing the hurdle. But the journey doesn't end here. The deal must still win approval from the House of Representatives and receive the president's signature to officially lift the shutdown. Virginia Democrat Tim Kaine, who plans to support the measure, framed it as a necessary step forward. "I have long said that to earn my vote, we need to be on a path toward fixing Republicans' healthcare mess and to protect the federal workforce," he stated. Kaine highlighted that the agreement secures a dedicated vote on extending ACA premium tax credits, something Republicans had resisted outright. Lawmakers know their constituents expect them to vote for it, and if they don't, they could very well be replaced at the ballot box by someone who will, he added, hinting at the electoral risks of ignoring voter priorities. This adds a layer of real-world pressure, where political survival might hinge on addressing healthcare woes. The standoff stemmed from Republicans pushing a short-term funding bill through the House that focused solely on keeping the government afloat without resolving the ACA's looming deadline. Democrats countered by refusing to endorse any stopgap measure that left those subsidies hanging in the balance. Under this negotiated compromise, Democrats gained the advantage of selecting the bill for that December vote, capitalizing on widespread public support for extending the credits, potentially swaying undecided lawmakers. Beyond funding, the package reverses permanent layoffs of government workers caused by the shutdown and safeguards against further staffing cuts until the fiscal year 2026 wraps up. It ensures full pay for federal employees during the period when many were furloughed or barred from their duties, preventing undue financial strain on hard-working public servants. Additionally, the deal promotes a collaborative, bipartisan approach to budgeting and curbs the executive's reliance on continuing resolutions, those temporary funding patches that often delay comprehensive planning. It also extends funding through September for the Supplemental Nutrition Assistance Program, SNAP, commonly known as food stamps, which aids about 42 million Americans in securing groceries. For context, SNAP is a vital safety net that helps low-income families stretch their budgets, reducing hunger and supporting community well-being. Imagine it as a lifeline for millions who might otherwise go without nutritious meals. This is breaking news, so stay tuned for further developments. What do you think? Does this deal strike the right balance between fiscal responsibility and protecting vulnerable Americans? Or is it a missed opportunity to tackle healthcare head-on? Share your thoughts in the comments below, and let's discuss whether political compromises like this truly serve the public interest or just kick the can down the road.